taking on the full investment that's required to finally finish the job. And that's what we're calling on, particularly considering the time horizon, 15 years to defeat the pandemic. What it seems to be required is a doubling of investments in HIV, tuberculosis, malaria, as well as the pandemics that are emerging. So core investments in health systems and data systems, and human worker and health workers, where the data show when you invest in people living with HIV to deliver essential services in communities, you benefit communities who are at risk of HIV, as well as pregnant women, as well as drug users, as well as many other people.
Does that mean doubling the global commitment or the U.S. commitment or both?
So the U.S. commitment, globally, just for HIV alone, it looks like the funding gap over the next several years is $6 billion. But this 8.18 billion increase that we're calling for is just 0.19%. So it's some of the most high impact State Department investments by any measure. It's actually measured in terms of outcomes, lives saved, policies transformed, and it's outrageous that Congress has flat-funded this program and that the current administration has proposed slashing it. And this is not a space where we see other campaigns coming forward with bold proposals. And it has to be wrapped up. This has to be wrapped up in a modern interpretation of foreign policy. It's about transforming people's lives through true health security, which is not, shiny machines. It's actually people not feeling terrorized because their kid will die of cerebral malaria, or not thinking that their health worker will out them as gay and HIV positive in Uganda, where I work, because of the training, the accountability, the investment in treatment, investment in fighting stigma, and work eliminating criminalization. That is all part of a transformative foreign policy agenda that's based on evidence, it's based on what's morally sound, and that's what we need candidates to step forward and take forward. And the data all point in the right direction, but that's the risk right now, is snatching defeat from the jaws of victory.
And have you put out a kind of breakout of how the funding will be used, or how we envision it? Is it kind of a doubling of the existing line items, or are there things that need to be added to the structure of our interventions now that we can't get funded?
So there are essential interventions, people waiting in line for life-saving treatment, for life-saving prevention.
So it's also scaling up what we do now.
And it's also a situation of wrong investments being funded, and so diplomatic work being necessary to ensure comprehensive sexuality education, a move to decriminalization, to attacking anti-homophobic laws and policies across, in particular in East and Southern Africa. Angola, Botswana just did tremendous decriminalization work, which is really heartwarming. Kenya just had a harmful ruling, so there's lots happening. But then there's new fronts as well. Cholera in Mozambique, brought about by climate change and massive catastrophic cyclones, one after the other. That if Mozambique had been better prepared through better investment in health systems, in lab systems, in health workforce over the years, then perhaps they could have responded more quickly. As it is, USAID is scrambling, people are dying, antiretroviral treatments being interrupted, there are all kinds of catastrophic consequences. This is a country with the highest burden of AIDS-related mortality for its size in the world. Mozambique is. Yeah, it's in Uganda, it's about triple the burden of mortality that Uganda has, for example. Triple. Because the intervention, the responses are so far behind.
Can we look at the domestic response? So, just on a personal level, I know I live in one, but a lot of us met with the candidates in 2016, and these activists, meeting with 20 activists in Hurry and 20 activists in Bernie, made some big asks to vote for them. Bernie said yes to everything, and Hillary said yes to about 40%.
Okay.
But a lot of us were just obviously brokenhearted with the result of the election. We thought we were going to get our first AIDS activist president because she had been walking about this for a long time. And we really want the candidates this time to be at that same level. We would love to see an AIDS activist president. And AIDS has gotten very wonky. I assume you've heard of U equals U, undetectable equals untransmittable. So there have been two major breakthroughs with HIV science. We discovered through large trials that if people are put on treatment and become undetectable, they can't spread the virus. So it's a major way to prevent the spread of the epidemic. As well as the U.S. government, in conjunction with the Gates Foundation and